to work on the client that had pinchy in their hip. It was always challenging for them to go through some type of glute stretch without them feeling some discomfort. So we did a few things. The first thing that we did was a hip traction. So just grabbing a band like this. This was a big opener for them just to find some looseness, we'll say, through the hip. So a band wants to pull their hip around, pull their hip out. So this just felt like a nice stretch for them, focusing on opening that hip maybe through the kind of swaying through the hips, but also kind of through their leg, through their femur, and just having them feel that hip open up. Kind of go back to the glute stretch, felt much better, no problems with that. And then just some of the strength things that helped them was just a single leg hold through their hip. So we didn't want to worry about balance. So we saw that just holding their hips kind of in this neutral position, they would hold this, was challenging for them. So they would just find their butt and just try to hold that position for a few seconds. And then we did a modified clam, just like this. So leg was behind them, and they would just push their leg backwards without rolling backwards and just find that butt and squeeze it and just hold that position. And that was it. So they did those three things. They would always check to make sure that hip would stay open, and that was it. So hopefully that helps you. Of course, if you have any questions, let me know.